The first person to survive Alzheimer's disease is out there. And the Alzheimer's Association is going to make it happen by funding scientific breakthroughs, advancing public policy, and providing local support to those living with the disease and their caregivers. But we won't get there without you. Visit alz.org to join the fight.
Good morning, everyone, and thank you for joining us for the Alzheimer's Association Annual Conference on Alzheimer's and Dementia. Those who are here in person, thank you, and those who are joining us on Zoom, thank you as well. And my name is Steve Fraser. I'm a news anchor at KSAT 12. I answer many different things. In my profession, I've been called many different things. But today, I'm here as a son who wants to learn about how I can help my mother, who's been diagnosed with Alzheimer's, like many of you here. And I am so grateful to be here, and I'm so grateful to have this room with people who can answer some of the questions and guide me through what is often a confusing time. And I'm very thankful for the room next door, where they have so many people who are willing to help, and so many people who can give advice to those of us who are going through this. I'll tell a little bit about my story and my mom a little bit later, but the Planning Committee of Outstanding Volunteers has coordinated a full day of education and support today. Please visit each of the exhibitors next door, and we want to thank them all. They are on the back of your agenda. Also, thanks to Chapters Living for donating breakfast this morning, and the Gonzaga Foundation for donating coffee. How about a round of applause? I'm also happy to see so many friendly faces and so many people who come up and introduce themselves. I always like to meet people and hear their stories and tell my stories and share with each other. I'm very happy to see Councilwoman Govington here. Thank you, Marina, for being here. And, you know, if you've been following the news recently coming out of the Alzheimer's International Conference held in July, we are now in the era of new treatments. That's what it's being called, the era of new treatments for so many people. There is hope for the future. We're going to hear a lot of information today, hopefully about some of those treatments. And again, thank you all for being here and for all supporting this conference. Special thanks to UT Health San Antonio and the Biggs Institute for hosting us as well. It was, I will never forget where I was. I was in the Apple store at North Star Mall. And my mom texted me and she said, give me a call as soon as you can. And usually, my mom's like, just give me a call. You know how moms are. But when she said as soon as you can, and I had the feeling that something wasn't good. And it was more than just that she didn't want me to buy the new iPhone. And I walked outside and I remember her telling me through sobs that she had been diagnosed with Alzheimer's. And it hit me like a ton of bricks. Not my mom. Why my mom? Why anybody's mom? And then the big question was, what now? And I'm still not sure that I have the answer to that. It seems like almost every day we struggle with something different. And I'm sure I'm talking to a lot of people who know exactly what I'm talking about. And, she's in Phoenix. I'm here. We have main family in Iowa. My brother works in Montana. So how do we all come together to try and decide what's best for my mother? And how do we prepare for Medicaid? How do we prepare for assisted living? How do we make sure she's being taken care of? So many different questions. And so that's why when Athena graciously asked me to do the welcome today, I said, of course. I said, because I feel like I'm with kindred spirits in this room. So many people, thank you. So many people who have reached out and been very supportive. And I said, it's just ironic, I saw that the Carol Birch Law Firm was in the next room. 2 weeks ago, I called the Carol Birch Law Firm asking for referrals for Phoenix. So thank you all for being here, and I want to thank all the organizations that are here to support as well. And I'm excited about what we're going to learn today, because that's what I'm here to do, here as a son. So without further ado, I would like to introduce Byron Cordes, the former board chair of the Alzheimer's Association and owner of Stage Care Management, who is providing CEUs for the day. He's a good friend to go back at least 30 minutes ago. So welcome, Byron.
I think we realized we went to different high schools together. Thank you for 10 of you that got that joke. Again, welcome, and thank you, Mr. Thank you for being so vulnerable and honest. That's hard. I know we have Alzheimer's in my family, and quite frankly, my mother-in-law wanted to keep it a secret. Right? She's embarrassed by it. So many people are, and we shouldn't. We should be in this room screaming from the rooftop. We can't be in this room and screaming from the rooftop, but we should be in this room screaming about Alzheimer's. So, welcome. So we are proud to provide the CEUs. Right now, we're providing nursing and social work CEUs. I know that many other professions can use those CEUs as well. So if you are in attendance and need CEUs, the registration table right next to it, we have a little form. We just need you to fill that out and get it back to us at the end of the day. Turn it in to anyone with the Alzheimer's Association. We'll get it back. We'll find it. Just make sure you turn that in. Online, sorry, we didn't quite do that well. So online, if you're needing CEUs, you can email me, Byron at sage-care.com, BYRON@SAGE-care.com. If you missed that, you can email the Alzheimer's Association, email the folks, I think, right, Jenny? Is that as we put this together, the contact information on the email that you got, and they'll find me. So, and we'll make sure we'll email out that CEU certificate to you as well. So I have a couple of people to thank as well. So I wanted to thank Councilwoman Marina Albrega. Oh my goodness, my wife missed the show. Thank you for attending. Again, the more that we can draw attention to this horrible disease. I also want to thank our board. If we can have we have about a third of our board, I think, in attendance. So we can have our board stand. I know we've got several folks from our board, from I want to invite up our 2-minute speakers. Oh, bathrooms. Right? Bathrooms, yeah. Just walk out here, back towards the registration table. So if you leave this room, take a right, and then take a quick left. And there are some pretty decent-sized bathrooms. And of course, our vendor room, our exhibitors are right next door. So you walk out of this room to the right and look at your student food truck. So please make sure you see them throughout the day. And with that, we want to thank our exhibitors that are going to be here all day. So we want to make sure that you visit them. With that, I want to invite up a couple of them. The law offices of Carol Birch. We have Helen Flores, the almighty Helen Flores. Just going to talk to you about
Hi everyone, good morning. So good to see you in person again. And for our Zoomers, thank you for being online. You're important too for this special day of education and hope, quite frankly. My name is Helen Flores. I'm a former board member for the Alzheimer's Association. I call myself their #1 volunteer. I need to tell you that's self-appointed. And the law offices at Carol Birch has been a long-time supporter of our local chapter. Carol Birch actually does speaking engagements for the chapter, the Alzheimer's Association, and she also connects with the UT Health program here to support that. We just did last weekend with my colleague Jody, the UT Med students put on a presentation and we joined them to help in collaboration. The law offices of Carol Birch specializes in elder law and disability law, so it's never too late to start thinking about your retirement needs, but also, you know, some of the services that are important to us, say a ladybird deed or a transfer on death deed, so that when perhaps you need to use Medicaid services, you don't want Medicaid recovery to come, a state recovery program to come back and take your house. You can plan to have that house given to your loved ones. We do probates, we do wills, powers of attorney. We also help with, long-term care planning. So for those of you, maybe a couple has just been given a difficult long-term diagnosis like dementia or ALS or Parkinson's, we need to start doing some asset preservation. Let's get your resources out of the ill spouse and let the well spouse have resources to take care for you, yet still qualify for Medicaid. So I just wanted to let you know some of the support services we offer. Thank you for the opportunity to sponsor your lunch today. I didn't make it, but I think it's still going good. Enjoy your day. You've got a resource of professionals in the room, inside this room, in the room next door. Utilize them. We are your support group. Thank you.
Okay, so with that, the UT Health Science Center, at UT Health San Antonio, the Biggs Institute, is that Dr. Patel? Dr. Neela Patel is going to come up and talk to us in a minute about your services. And thank you for your support, as always, for disease and these patients.
Thank you. Good morning, everyone. A very happy Saturday morning and a hopeful Saturday morning. So the Glenn and Ann Biggs Institute was founded in 2017 by a big donation and efforts by President Henrich to have an institute to learn more and to find ways to treat and manage Alzheimer's, dementia, and other neurodegenerative diseases. In 2021, we got the designation of National Institute of Aging Alzheimer's Disease Research Center. As a center, we not just provide care for patients with dementias and neurodegenerative diseases, we also research to try to find answers because we still don't know it all. We also get patients, normal people and persons with dementia to donate brains because the best way to learn about the disease is actually to look at the tissue to see what's wrong and what caused the tissue to go wrong. We also have genetic studies, biomarkers, that is taking blood and looking at markers in the blood or the spinal fluid. We also have outreach activities. So we have 10 different cores, and we collaborate not just with the School of Medicine, but with all the other 5 schools at the Health Science Center, with the School of Nursing, School of Health Professions, with the Dental School for Oral Health, as in memory cares and nursing homes, as well as people who live out in the community. We are very grateful for all the support that we have got from the San Antonio community and beyond, and to many of our councilwomen and to Ms. Maria here today. So we are in this journey together, and we appreciate everyone's coming together to find answers. And we know we will. I know later today Dr. Sheshadri, who's the director of the center, is going to give you all a talk on what's new and what's coming for us to find answers to this disease. Does it affect just the individual, but the entire family and community? So we all need to be on the same page. There's more to come. Thank you.
Truly, we are blessed to have the Biggs Institute and, of course, UT Health here in San Antonio. So we don't know about the Biggs Institute. And the NIH designation is huge. I know you spoke of it, but that was huge. First one in our state, really in the region. So thank you for that. Actually, Ayala of the Alamo Area Council on Governments is going to talk.
Come on up.
Come on up. Come on down. You're the next guest.
Good morning. I'm not Ashley Ayala. My name is Enrique Guerrero. Ashley is our coordinator for our program. Thank you so much for having us today. So I'm going to give you a brief introduction on ACOG, and within ACOG, the area agencies on aging. So what can we do for you to help you in caring for your loved one or caring for yourself? The first thing that we can tell you is that anyone above the age of 60 qualifies. That's it. We're not income-based. You just need for you to know that above the age of 60, and we can provide you some assistance. After that, we have a lot of services that are available to you to help you through that process, and to help your loved one through that process. But one of the most important things that I can tell you, if you got a paper and pencil in front of you, please come visit us, is the point of contact number. That's 210-477-3275. You can call that number and ask whatever question you like about aging or access or what's available to you or to your loved one and how we can help you get through what you're dealing with. So now we'll go through a couple of the services that we provide, some of the main ones. For some folks it may be something like residential repair. We can provide you assistance with grab bars, maybe in the hallway, maybe in the bathroom, maybe in the shower. For some folks it may be something like health maintenance. Health maintenance is then going to take care of things like incontinence supplies or nutritional tools. I'll break down particularly what the cost is out in the market for getting some of those items. We also can provide access to counseling. When you start to deal with grief or depression and you need someone to talk to, we can help connect you to someone who can assist you through that process. We can also help connect you with educational services or hands-on type things when you need to really assist someone from getting in or out of bed, from getting in or out of your chair, from getting down the hallway. We can help provide that education. We can provide it in several different ways. We can provide it online, and we can provide it in a hands-on format. So those are some of the services that we can provide. And I encourage you to please stop by our booth. Ask us whatever question you like so we can help provide you the information so that we can help you. Thank you so much.
And the AAA, Area Agency on Aging. So I do want to say real quick, breakfast is here. I know it's a little late, so if you miss breakfast, it is in the room next door. So please go help yourself. Be quick and go to shifts. And we also have coffee over there. And then just outside the door here, there is water. There's cold water and room temperature bottles of water. So if you need that, please help yourself. And with our sponsors that are speaking are our top sponsors. They have just kind of come out in force to support this conference. And so please take note of it, make sure you visit them, and some of their banners are along the back wall there. So just be sure to stop by and for helping us make today possible. So with that, I'm going to introduce Bill Zinsmeyer. We are old friends. We go back for 30 minutes. So Bill Zinsmeyer is a fellow board member with me. He's going to introduce our first speaker. So thank you, Bill.
Good morning. Good morning. Good to be here. I have the pleasure of introducing one of our people who's already stepped up, which is Dr. Patel. But let me ask you something. I am a caregiver. How many of us are caregivers? Those of us are caregivers. I'm in my 8th year. My wife with Alzheimer's. That's why I'm here. That's why I work with the Alzheimer's Association. And through that, I have met some very special people. And that is why I asked to introduce Dr. Patel, because she has been instrumental in my life, handling the ability to be a caregiver and stand up as a caregiver. It's a lonely job. It's a very, very tough job. And it is truly defining the fact that Alzheimer's and dementia is a disease of two. The person with the disease, and more importantly, the person who is that caregiver. So I'm thankful that you're here today. So Dr. Patel is my wife and I's primary care doctor. And I met Dr. Patel through the Biggs Institute. And I had an opportunity to serve with her and my wife also on a committee, studying and learning about what we can do better as a caregiver for a couple of years, which was called the Corey. And we met in this building for 2 years. It was kind of nice to come back home. Dr. Patel is with the University of Texas Health Science Center at San Antonio, Division of Geriatrics and Supporting Care, as Associate Professor and Chief. She is the Glenn and Biggs Distinguished Chief Alzheimer's Patient Care Award and Joe Barr and Teresa Lozano Long Distinguished Chair in our community of Geriatrics. She is jointly appointed to the Department of Family Community Medicine and the Glenn Biggs Center for Alzheimer's in Neurogenic Council. Dr. Patel serves as Outreach Recruitment and Engagement Core Director for the designated South Texas Alzheimer's Disease Research Center. She attended school in India at the King's College University. Her residency and geriatric fellowships from UT San Antonio. She is board certified in family medicine, geriatrics, medicine, and hospice and palliative medicine. And she is my friend, Dr. Patel.
Thank you, Bill. So I'm going to be talking about how we live with this disease. But I think we all pretty much know what happens to the brain for this disease. The main objectives are how can we care well for persons with dementia, and what specific changes we can make at each stage of the disease so that we can live well. So before I go on to the stages, just a brief on, so basically dementia is a disease of the brain. Like diabetes is a disease of the pancreas doesn't make enough insulin, and so we have diabetes. Same with dementia. There are changes in the brain that occur. There may be many different reasons for it. It may be the deposition of tau protein or amyloid. It could be a stroke that has compromised blood supply to the brain. It can be Lewy bodies or something that's in the brain. Whatever be the pathology or what's wrong with the brain, the disease occurs because there are changes that shrink the brain or make the brain much looser. We have like 46 different areas in our brain that have a very complicated network of wiring or connections. And when the brain tissue is damaged, either through deposition of amyloid or tau protein or because of a stroke or whatever be the reason, the communication between the different areas is what is lost. So what happens when a person has brain disease? Is brain health failure. They are not able to live the way they used to live consistently. Because this wiring gets a little loose, they're sometimes perfectly normal and you wonder do they really have dementia. And sometimes, you know, it just doesn't work. That's what we call as good days and bad days. Okay. So, one of the biggest mistakes that we make, I've been a caregiver for my mom who had dementia at a very young age, and we assume that the person does not know and does not understand. But that's not true. Of the 46 areas in the brain, understanding is there, knowledge is there. Dementia is a disease of the brain where communication is the problem. The person knows and understands, but is not able to consistently communicate what they know and understand. So we cannot ignore that person or treat that person different because the brain is working differently now. We try to understand what is not working at this point and see what changes we can make in our approach to our loved ones so that we are respectful of their individuality and are caring for them just the way we would care if they were having a normal function. So basically there are three main stages: an early stage, a middle stage, and an advanced stage. In the early stages, we noticed that there could be issues with managing finances, balancing the checkbooks or paying bills, forgetting to pay bills, forgetting recent events or names, difficulty remembering to take medications. So maybe the blood pressure is too high or the diabetes is not controlled because, or it may be too low because if they've forgotten that they've taken the medicine and they're taking it once more. And difficulty recognizing common things. Okay. In the middle stages, they're needing help with domestic care, with household chores, buying groceries, getting lost in familiar places, driving especially, wandering off, periods of irritability and agitation because they know something is wrong. You know, we don't know, but they don't know how to communicate that. And difficulty in recognizing family, especially family that they don't see every day. In the advanced stages, you also see there are difficulties in swallowing and eating. We need to give a lot of cues for that. Forgetting how to walk, you know. There's nothing wrong with the muscle of the lower extremities, but the process of how to get up, how to take the first step, it's like, you know, the brain becomes like that. It's like a reversal, you know, you become like a child. So an infant, when the infant is trying to learn how to walk, that's what they forget, how to walk, and need cues to help with that. Dressing, especially complicated, you know, like trying to put buttons, the fingers, the agility is lost. There's minimal verbal communication because vocabulary is lost. And recurrent infections because of inability to care for themselves and perinatal hygiene. So I will discuss in each step, in each stage, what are the strategies we can use so that we can make life better. So for remembering, so early stage, if somebody says, I've just been diagnosed with dementia, now what? Okay. You want to simplify life. I say when we're younger, and irrespective of whether we have a brain health failure or not, I would say it's important to simplify life the older we get. And you want to just narrow down from a bigger outer circle to an inner circle to things that are most important for you, and then making like a notebook, carrying a notebook, writing the date and things down. Because the more a person gets frustrated when they don't remember things, it makes the communication even worse. So helping them to remember. And then a diary calendar for orientation. We generally, because the brain structure is changed, having a normal conversation is not going to be normal if we just talk a lot of sentences and huge paragraphs. We need to give time for the person to register what we're saying. So talking in simple sentences with eye contact with them in front of you helps them to understand and respond. And giving enough response time. Many times I have family, either children or spouses bringing patients, and they tend to talk for the person with dementia and not give time. And I have to tell them, I know you love your spouse or your mom or dad, but let me just understand where your mom's communication ability is right now. You will get your turn. I need your help in getting all the information I can to help your loved one. But let's not take away from them what they have. And they'll be surprised because they come up with exactly what they want to say, and then looking at them and talking. Many times, we just ignore the person in front of us and we're talking only to the caregiver or to the family. But you're missing out on communicating and caring for the person who's just right in front of you. So it's important to talk short, simple sentences, eye contact, and be very patient and give them time to respond. And many times what happens is after we tell them, and you walk away or you do something else, they come back with the response to the question that was just asked before. And that makes them feel good that we waited and were patient enough. Carrying out daily tasks such as shopping, cooking, or taking medications, you want to have fixed days and times, and if they are able to shop, like giving them a list. But as it advances, it becomes difficult, the eyes and all become too confusing, and especially if the store changes where they keep the things normally, it makes it even more confusing for them. And doing chores together. So I tell, if they have the ability and they want to go and buy their groceries, but they're not able to do it by themselves, then anyway the children are going to help or the spouse is going to go and do it. Why not do it together so that they still feel a part of it and they feel responsible for doing it for themselves. Using and understanding language, so simple language, so basically you don't want to lose the ability for doing it. So retraining the brain and maintaining the ability that they have. So simple, I tell them, yes, you try to find the word and the word puzzle and all works, but even like, kindergarten workbooks, first and second grade workbooks, identifying the object. All this is cognitive therapy to keep the ability to have what they have. And if you have grandkids and they are teaching grandkids, I think it doesn't make it so confusing and they are able just to keep that skill with them. Making decisions and planning and getting organized. As soon as you're diagnosed with it, understanding like how it could progress. We do have some medications now that trials are going on to slow the progression of the disease. But we can slow the progression of the disease by simplifying life, keeping a routine and structure, not taking away abilities that they have. And if they're living in a home and family, assigning some chores that they can still do. Laundry, folding the laundry, helping with the kitchen, whatever they like to do. Know the person, identify, know the person, what they really enjoy doing in life. Do they still continue to enjoy it? And how can we make them still do what they like to do? Okay. Finding their way from one familiar place to another. You want to offer a chaperone to go with them. Or like many of them for church especially, are going to quilt club, or they wanted to go there but now they don't like to go there, especially with all the road constructions and detours and everything. They get very confused in trying to drive even to a place that was very familiar to them. So having somebody else go with them and say, oh, I would like to go with you, so that they don't feel like it's a burden for them, and letting them to continue to enjoy what they like. The biggest mistake we make is we take away the abilities they have because they're a little bit more slower and the response time is slow. And that's the worst thing we can do for our loved ones, is taking away from them the ability that they still have. Managing finances, assistance with savings, so like helping with auto payments for utilities, assisting with getting groceries for them, or having it legally done, managing the finances for them. I think Carol Birch just mentioned about how they assist with that. That's really very important. Forgetting recent events or names, and especially a family member that you don't see that often. So whenever there's a family gathering or a social event, it's good to wear name tags, so that they can read the name, and that brings back memories, and they don't feel like they've forgotten the name. And introducing yourself. I had to keep reminding my mom that I'm her daughter, and they call me Lady at home, so I had to keep reminding her that. She used to always mistake me for my sister, older sister. We both look very similar, and I had to keep reminding her who I was. And at the time when she was passing, the only two people she could remember was her granddaughter and her son. But I didn't feel like she didn't remember me because she was looking at the corner of the room, and I asked her where you're looking, and she said, oh, your dad's come to get me. So she really knew who I was. She just didn't have the ability to communicate. And I know as caregivers, all of us face that. We feel like our loved one doesn't recognize us anymore. That is not true. They do recognize us. Their ability to tell us who we are is lost, but they know who we are. Difficulty remembering to take medications. I think pill boxes is not the only way, because sometimes you can have pill box and they may take for all the days together. But you do have the newer technology ones, but new things are a little hard for the brain that's not functioning well to learn. New things are a little hard, but maybe having somebody to go and give it to them. And for physicians and doctor offices, we suggest give once a day medications if possible, so that they don't have to remember to take it that often. And also, if somebody's going to go help give the medication, supervise giving the medication, then it's only once a day that they have to go and do it. And a little later, I'm going to be talking about the lesser medicines we take, the better, which also helps with the memory. Difficulty recognizing acquaintances, I said naming and introducing, and name tags is one thing that really works, especially for family gatherings, Christmas or Thanksgiving or birthdays. It's good to have name tags and they feel nice about it. In the middle stages, they're needing time with chores or hobbies, making it as quality time. Children or spouses, you just make it as that's your time together, and that's the time you're going to be working on chores that they liked doing, but are not able to do it on their own anymore now. And getting lost in familiar places, especially in the home sometimes, and at night when it's dark. So having like the motion sensitive light when they wake up, many times the bathroom and pantry or something, a closed place is forgotten. And later I'm going to show you about labeling and pictograms so that they recognize. And especially when the environment is changed. So they know everything in their own home. But if you're going to visit a family member or going out on a trip, you don't have to stop doing all of this because the brain doesn't function. You just have to find out what you need to do to help so that week or time off or visiting family is going to be meaningful for them as well. So sometimes there's irritability and agitation. So that irritability and agitation is mainly because, as I mentioned, they know and understand, but communication is a problem. They don't know how to say what they know and understand. So irritability and agitation is always, always, always an unmet need. We need to take a step back and say, what is he or she trying to tell me here? You know, are they cold? Are they hot? Are they hungry? Are they constipated? Are they in pain? Are they upset? We did not include them in the conversation. You know, so we really need to take a step back. And the best way to read is to redirect. We also try to over-explain things to our loved ones out of respect. That because we respect them as an individual. But that explaining is making it worse because, as I mentioned, we need to talk in simple sentences. So when we're talking too many sentences together and trying to explain them, we're not giving enough time for them to digest what each sentence, and so it becomes too complicated, and that's where the irritation and frustration comes from. So everything really does not have to be explained. As long as we know our loved ones, we know what they want, what they prefer, what's important to them, and we focus only on what we know would be the best decision they would make if they were making this decision themselves. Difficulty recognizing, I did mention about introducing and pictures. So one good activity to do together for them to remember family and loved ones is collage of pictures, naming, labeling, and revisiting pictures. That's a good activity to just to remember old pictures and write down the names and newer kids. And fixed times for like when children are visiting or families calling from out of town. We want to keep fixed days and times, so we're keeping them oriented to date and time, and then they look forward to, oh, today's Saturday, and my daughter from California is going to call me today. Okay. So that helps to keep them oriented as well. Later stages, mobility is impacted. So in having a walker, good lighting, their risk for fall is much more because of visuospatial effects that happen with this part of the brain being affected. Like this carpeted floor is just not the right one for severe dementia. The too many colors, even though it is just one, it gives a false perception that there are two, the depth is different, and then you lose your balance and you will fall. So you want the non-flashy floor, non-skin, and have the edges in a dark order so they know that the wall is in the side. That is the best type of flooring to have. Difficulty with personal care, and so having a routine for shower, bathing, and clothes that are much more easier to put on and take off, and controlling their bowel and bladder. Best is to schedule the toileting. It's like potty training all over again, and best to schedule having a bowel movement after having had a meal. So whether their habit was to go at night or to go in the morning, have them have a meal that gets the gut moving, and then have them walk, and then have them sit on the potty, and they would have a bowel movement. Because that is one thing that is very important for their dignity, and it makes them really very upset when they're incontinent or they are having a bowel movement on themselves. We also notice that as the disease progresses, showers become a problem because they're scared of the shower. And a bath is better for them. Also, maybe using a handheld shower and starting slowly with wetting the feet and then going up rather than just a direct shower. It's like kids, when we try to get them to have a shower, we don't start with the shower, we start with the bath first and then slowly progress on to shower. It's the same way. And sometimes a shower together. Many times I would have a bath with my mom. I would start with wetting both our feet and kind of make it fun. Because I knew she was a person who would take a bath twice a day. And if she was not, just because she was not able to communicate what she wanted, if I didn't give her a bath and left her alone, I know how upset that would really make her. And so we had to find ways to still do what was important to her, but in a way that was not so hard for her or for us. Swallowing and eating problems, you want them to sit at the table, not in the bed or the recliner. So making it a habit to have all meals at the table. And sitting and tucking the chin, so not talking while eating, and having them just focusing on the food. And sometimes they pocket in the mouth, and so just helping them with like tapping the chin so that they swallow. Inability to walk, bathe, dress, and toilet independently, you do want supervision and simple hold. So buttons become hard, so maybe just a Velcro or just something that they can wear from the top. But many times, as we get older, we also have arthritis, and lifting up the arms is difficult. So you may just have to have something that's full open with Velcro, but not complicated buttons. So for minimal verbal communication, eye contact and giving simple choices. So many of our patients who have dementia love eating out, but then the menu is too complicated and confusing for them to decide what to choose from. So giving them a choice. We know who they are, we know what they love, asking them, do they want A or B? You know, do you want a sandwich, or do you want a salad, or do you want a casserole? So you want to give them just one or two things. Do you want this or this? Even in clothing, you want them to choose, you know, which clothing they would like to wear. Just because they're not able to choose it on their own, you can still engage them in that. By picking out two and asking them which one they want, then they feel like we've still included them in that decision, and they're wearing what they like. And sometimes they may tell you they don't want either, you know, and so then you've got to pick up another two more. And then again, you pick back the first two you brought, and in the brain, it's something new. Okay? So you have to try in many different ways to engage them in decisions that affect their life and ours. And the toilet schedule I did mention. Recurrent infections is mainly related to hygiene and lack of hydration. They don't remember to drink enough water, and sometimes they don't like to drink water at all. Okay, so things like popsicles, watermelon, fruits, cucumbers, all that is also water, or making smoothies. And ice creams, there's no restriction. Even diabetic can have ice creams. Okay, anything that is going to get the water in and the hydration to help with preventing an infection. Using baby wipes also helps with keeping the hygiene when it's difficult to, especially if it's difficult to give showers every day. So the signs, as I was saying, having signs of family room and the orientation for the clock, making it simple, vague for them to remember. And the toilet, because of visuospatial, it's important to have the toilet seat a different color so that they can visualize and see that that's the commode for them to sit. So redirecting and engaging them in activities they like, so doing activities with them. And I don't know how many times I've unfolded laundry and given my mom the same laundry to fold again. And she was in her happy space, she would be singing her own song, you know, that she liked singing and humming while folding the laundry. Reading, especially somebody who was reading a long time and reading becomes difficult for them now, or they're not able to follow the story. Reading along with them. Family pictures as well. Some people like being on their own, and so all the Legos and blocks and toys help. Doll therapy is is something that they're really studying and noted, that many, especially women, like keeping a doll with them. And just like kids, they like a particular blanket and all that, our persons with dementia also may find that comfort in a blanket or a particular jacket or sweater or something that was given by a family member. You want them to keep it and redirect them to that. This stimulation can be done as a group, as a family together, or individually if they prefer quiet time. Board games that they are used to playing, together, or just a couple of them together. Rather than having the TV on and just, whether they're interested or not, just keeping the TV running, I think there's so many more other things that can be done to redirect and to keep the mind, whatever of it is fine, still maintained and working. The folding laundry and gardening. A lot of women, some men also do like gardening. And so finding a way, just small potted plants, something, that they can still do together. Walking outside with them. And then, dessert always works as a good redirection. Somebody is very upset, just make it as a time to have ice cream together or cake together or cookies together or something. It makes them really comforted, it's comfort food, and calm, and then you can have a more meaningful conversation. So what better way to look at how can we live better than the age-friendly way of doing it, which is now actually the 5 M's, focusing on really what is most important and what matters most to our loved ones, on a meaningful life and meditation, reducing the number of medications, moving, mobility. The more we move, the better agility and mind. So the other M I say is meals. Okay, it doesn't have to be just 2 meals. They can be snacking on the whole day, making sure that they've got enough protein, hydration, fruits, and vegetables. Offering ever so often, and whatever they like, and really there's no restriction. Like many of my patients with diabetes will say, are you sure I can eat as much ice cream as I want? I said, of course you can, because you really don't eat a whole lot anyway. Your best meal is breakfast and maybe a little light dinner. So you can eat whatever you want as long as you're hydrated. Keeping meals simple, whatever we know that they enjoy. And sometimes what happens is the preference for meals changes. For years they would have liked eating something, but then they decide they don't like it anymore and they want to eat something else. So it's like a trial and error. We decide and see what they like. And I was, so whatever is important, we are in South Texas, so tacos and tortillas and all is more important, but whatever they like eating, oatmeal, whatever they like. And offer one thing at a time. So don't offer everything in a plate. Offer one thing at a time. Like even when eating out in restaurants, get the salad first, then get the entree, and last of all the dessert. Don't make everything right in one. And for some reason, brighter colors helps them to figure out the food better rather than a white plate. A red plate or a brighter colored plate is really what helps. Same thing with the cups. It helps. I don't know with visuospatial why, but red color seems to also have a calming effect on them. And then consider home delivered meals if they're living alone. And mealtime, making it a social time with friends, church and family members. So San Antonio is very blessed to have so many senior centers by the city of San Antonio and Alamo. And that is such a meaningful way to get together, have a meal, do some interactive things. Many of my patients will say, oh, but I don't like a big crowd. So you don't have to be with a big crowd. Find a smaller table where there's just 1 or 2 people. And you don't have to talk if if you don't want to, but just observe. Just being around your peers and having meaningful time is really what helps. So I have to negotiate with many of them. I have to tell them, do it for 4 weeks. Go once a day, once a week for 4 weeks. And then if you come back and tell me this is not for you, I will not ask you again. And really so far, I have had only one patient who told me it wasn't for her. But everybody else was, I don't know why they're not open on weekends. Medications, all you need is less. Really the best number of medications as we get older is 0. But we also have diabetes, high blood pressure, high cholesterol, heart disease, COPD as we get older. And so we need to minimize. So every time a doctor's visit, ask what medication we can take away, what medication we can stop. Okay? Because especially with the changes in the brain, medications stay in the system longer because of changes in the kidney, and that affects thinking. This is a real in the office. All the 5 bottles are the same medication, 3 different doses. And so, helping with medications really counts. So we do the Cariños and Sukasa program, which is where we go to the patients' homes. We have a couple of community health workers who help us as well. It's doctors and nurse practitioners who do home visits to help. We started it in times of COVID because we were the family for the patients, and they let us into the homes to see how we could help them. And we involved, some of the patients didn't want us to go in, and that's where we had our community health workers help. They took iPads and hotspots and did FaceTime visits with us while they were in the patient's home for us to help care for the persons living at home. But medications is a really big issue with not just persons with dementia, but with older people. So the older we grow, we don't need. Somebody could have been diabetic for 40 years. Body mass has reduced, muscle mass has reduced. The insulin that the body now produces 40 years down the lane is sufficient to manage the person's glucose control. They really don't need that 40 units of insulin that they were taking before. It's very hard for patients to understand that these changes have happened in the body, but then, the blood sugar keeps dropping every time, and they don't like that feeling, and then they trust what we are suggesting and saying and decide, okay, actually you're right. Again, I make a negotiation and I say, why don't you try it for 1 week, then we make it 2 weeks and increase it and see if that makes you feel better or makes you feel worse. But the lesser the medications, the better. Simplifying the regimen, de-prescribing, reminding the person on the phone or FaceTime if they're still able to use that. Simplifying the number of doctors as well. We don't need a doctor for every part of the body. As getting older is life, and getting older is not a disease. So just like a person whose brain health is compromised, and we have to change how we live so that the person also can live well. As we get older, we just need to make lifestyle changes so that we can age well, live well, age in place, be independent as long as we have it. Okay. So managing medical problems, so you have to actually manage the health of the person and not just the disease. You're treating a person, not their disease. And each person is different. There's no one size that fits all. We've got to see who the person is, what's important to them, what kind of needs they have, how active they are, how many medications they are taking, what do I need to do for this person. Meditation, meaningful life, and peers. They say, oh, I talk to my daughter every day, I talk to my sister every day, my son comes over to see me, but it's not the same as just talking to your friends and peers, And you really don't need to know the person, just go talk around. Tomorrow you go to the senior center, it's a totally different group, that's fine. You're just having a good time. Mobility, any amount of mobility, moving is enough. The PBS channel has the Sit and Be Fit. They used to have it at 11 a.m., But many of the people living in independent living and assisted living, that's the lunchtime. So they move the time to 1 o'clock. So 1 to 1:30 is the sit and be fed, and 1:30 to 2 is the stretching exercises. I recommend all my patients to do it. I tell the caregivers it's good for you as well. So both of you all do it together. That becomes meaningful time and time spent well together. Enjoying activities, so grandkids, water therapy, all that really helps. Stretching and balancing weights, water bottles, soup cans, anything, whatever weight you get is good to use for stretching. And focusing really on what matters most, knowing the person. What I like about being a geriatrician is I learn more from my patients and caregivers than I ever learned going to medical school. I've learned more in my practice than I've learned from textbooks. And it's a very wise people, and what they say, a wise person is one who learns from another person's mistakes. And I think I learn every day. My patients and caregivers teach me something new every day. What I know is from being a caregiver, I say now I'm a professional caregiver. As a physician, I'm taking care of so many, so I'm still a caregiver. I took care of mom and grandparents and people at home, but I also do take care of my patients in the community. So knowing each person, knowing their story, I start with tell me about yourself, who you are, what makes you happy, what keeps you going from one day to the next. Recently we had a family that was having a challenging time accepting what's going on with mom. And it's not easy, it's very hard, because there's nothing outside to tell us that there's something wrong, right, when the brain is not working. But then still the person is not the same person we knew. Okay? They are still the same person, they're just behaving a little different. So focusing on the story, each one's story is different. There's it takes a village. It's not even a team, it really takes a village, an entire community that we're seeing here today to take care of a person and family, and communication is the key for us to focus on. So, pardon me for the pink color, I think I should have chosen white, but making sure that we are closer to them and light touch that's not threatening is really good. Eye contact, our tone of voice, it's very frustrating for us, and sometimes we lose it. We yell and scream, and that really doesn't help. It makes it even worse. Then our loved ones are withdrawing into the shout. Simple and positive. So if we don't want them to do something, we shouldn't say, don't do that, or no. They don't like hearing that. They should hear the yes. We'll get to that. Let's finish this first. Okay? So they know that we understand, we are respecting, we are paying attention to their need, and it doesn't get them upset or hurt. The attitude also, when we are, if we don't feel like we're going to be able to be patient with them, it's better to walk away from the situation rather than be annoyed, angry, and validating. I see that you're upset. When we see the agitation or irritability, saying, I see that you're upset. I wish I could help you. Can I leave you alone for some time? Just the moment you say, I see that you're upset, they understand that we are upset. And redirecting. So I showed all the different ways to redirecting. The best is food, giving them something to eat, music, dancing. I have a Korean couple, he's a retired family physician in the Air Force, and he has dementia, and his wife starts putting music and square dancing with him when he's got upset. I even have a video of that, of what she did. She's come up with ideas for redirection. And it may not always work, so it may work for some time, and then you got to kind of like have a toolbox of all the things they like and they enjoy. And then choose which one you're going to use to redirect them so that they're not so upset. So it makes them feel all the more awful after they've been upset. That's not who they are, and that's not who they want to be. And And so we want to help them not be that upset. So as caregivers, I always say, every time, and Bill can tell you about this, whenever they bring the loved ones, I always ask, and how are you doing? Are you taking care of yourself? How can we support you? And there's Sarah here, who's a very good partner with us, with the caring for the caregiver. She started, and there's Joanne somewhere. So we refer. But many times, even though we are a geriatric practice, we do see the caregivers to just make the visit so that it takes away time from you having to go for another doctor's visit, and we try to see both together. Our staff keep the person occupied so that the caregivers can have their own time with their physician. So you've got to seek support from other caregivers, because nobody will understand the journey better than somebody else who's doing the same thing that you're doing. And taking care of your own health. We really cannot serve from an empty vessel. We really need to know ourselves when we are tired, when we do need a break, and how to find a way. Many of my caregivers will say, oh, I don't have the time. You've got to make the time. Who are you fooling? You know, there's going to be no caregiver left. There's going to be no you left if you don't take care of you. You've got to find a way and a community comes together, a family comes together, friends come together to help with this. Accept offers to help. So many times I notice people will offer to help and the caregiver will say, no, I'm fine, but thank you for asking. No, take that help. Just take it. You don't know, even that 30 minutes, 1 hour, what a huge difference it's going to make for you. Learn to communicate effectively with doctors and be assertive with doctors. They're trying to push another pill or something. No, you've got the tools. You're the advocate for the loved ones and for yourself. And it is hard work. It's really a full-time job, 24/7 job, as Bill said. You've really got to take respite and breaks. So here I would say one thing. Many caregivers feel very guilty when we talk about maybe it's time to move to a more structured environment, to move to assisted living or memory care. They feel very guilty. No, I promised that I would meet them at home, and you tried and it still doesn't happen. Just the way the brain disease happens, the structured environment is actually much better for them. I don't say this is for everybody who has dementia, but each person is different. And sometimes it really helps to have a structured environment. They do much, much better over there. A retired professor from UT, his wife had it, he wanted to keep her at home, and it got too overwhelming for him. And I told him, why don't you just take for his fight? Just say 4 weeks for a break for you. Let's try the structured environment for her. And then he said, you were right. She's doing much better. Bill's example is the same. They're having a much better, meaningful relationship in life because the structured environment helps. They love the home, but then it becomes too overwhelming for the brain based on what has happened to the brain to manage it, and more confusing. And then what abilities they have also is lost. So if they recommend that you need to move to a structured environment and it will help both of you, don't take it as a guilt that you're not taking care of them. That's probably the better thing you're doing for both of you. And you're having a better life. Not everybody needs it, but for those who need it, it really helps. Because some of them do have a pretty good routine and structure, and nothing much has changed. But some of them, it drastically changes the way they live at home. And the ability to live that way is lost. Okay. You need to watch out for signs of depression. And as we get older, depression is more irritability, losing it, not having any patience. So if you're feeling like you're not having too much patience, you're getting very irritable, not just with the loved ones, but with family and all that. You want to take this step back. You want to find out whether you're depressed and take care of it. Be open to new technologies to take care of the loved one. Organize all the medical information in one place. So, because it's important everywhere you go that they see the whole person and not just the brain disease, and make sure legal documents are in order. And give yourself credit, because oh, that's my mom, I have to take care of her. But no, mom had 7 kids and you were the only one taking care of them. So you have to give yourself credit for what you're doing. It's the toughest job. We don't come with it, we didn't apply for this job. We got it, you know. So you've got to give yourself credit for it. She's 102 and lives by herself, and her daughter, who's about 80 now, is in the next apartment, and you know she is more sick physically than her mom, and she cooks for herself still. She has to have her breakfast taco that she has eaten every day. So don't take away from them what they don't have. She doesn't remember everything and everyone, but she's still able to live in her own environment which she has for years. So why take her away from it? Thank you all, and I think questions will come later. Ginny? Or now? Oh, or now, that's right. Yes.
So I have a question. I noticed that you have determined 4 stages, right? Is that what, more or less?
More or less 3, early, middle, and advanced.
And so,
The question was if I had defined 4 stages and I said 3, early, middle, and advanced.
And so I've had a good experience with this, and so I hear other people now talking about it. At what stage and how often do you find where Alzheimer's patients can't find the mouth to eat? And what do you suggest is a good proactive way to deal with that?
So most of the time it is in the advanced stage where they have difficulty with swallowing and chewing and eating. But if we early on itself simplify and serve one portion at a time and give them time to chew and eat and make it like at least 2 of them eating together rather than them eating alone, it helps. But speech therapy helps for both cognition and for swallowing.
But define your mouth.
Yes.
Define, speech therapy is a good thing for that.
Is good for the swallowing. Also cutting up food and using utensils that are much more easier to use. Finger foods is something that they use much more often as the disease progresses.
Thank you.
Yes.
Is there something available now for those who wander? Because they are really quick to be turned around 1 second and the next second they're gone. My mother was a wanderer and she could take, I never seen her walk so fast. I don't know. But she would wander, we couldn't find her one day. She was like 10 miles away and we had no idea how she got there. Do they have trackers for them now?
So the question is there something for the wanderers because they wander really very fast and once a mom was found 10 miles away. The closest I can say is I think what Apple has, the iTags, but they should have it on them. Others I tell if you have phones and we go out with the phones and you have smartphones where you can share location, that's another way to keep track of them. And sometimes they may not be willing to share location, but you know, now this is a perfect example of where we don't have to explain everything to them, but we need to do what's right and best for them. And make sure that you're sharing and tracking location for them. So you can have like a life alert with an eye tag behind it, so you're going to be able to track them. Many of them have watches also that they wear, and that can pick up a fall and have a location attached to it that can help as well. So that brings me to another thing about having cameras, and many people feel like they're invading into their privacy when you have cameras. But you're looking at is like, sometimes you're not going to get the best fit, and you're going to try to look for what's the best thing for them. at least it helps to make sure that they are more safe, and like you have the ringtone and the smart doorbells which have cameras in different places that you could see, so that you can talk to them. Like especially for helping them to take medications and all, you can really help them out if you had the camera. You don't have to have it in the bathroom to invade the privacy, but the living area, and it could be very helpful to have a camera as well. Yes.
And there's a question online, how do you know when people need a more strict environment?
So when you see irritability a lot more, when you find that hygiene is becoming a problem, the fridge is full of food that they haven't really eaten, they're losing weight or gaining weight, then you feel like, okay, they need a little bit more help. You do provide some hourly provider or caregiver help, or the family caregivers take on that responsibility themselves. Despite all of that, it's still not getting any better, and you're tired as a caregiver, then you want to probably try a more structured environment to see if that helps. Yes?
Sleeping, I saw that you didn't have sleeping, is excessive sleeping more of a sign of Alzheimer's, or is it more of a sign of depression?
It could be both, actually. So more of depression, when they're sleeping more, they're trying to avoid. But also, since communication is a little difficult, it could be dementia as well. But sleeping, it's better to keep a hygiene and go to bed at the same time every day, because watching TV, different movies, different shows, and then sleeping, it really doesn't help. Shutting off all the stimulation of phones, computers, TVs, at least 30 minutes before you go to sleep. Changing into more comfortable clothing, brushing teeth, having some lotion or something, and then, there is research to show that praying, irrespective of what your spiritual beliefs are, praying before you go to bed or being grateful for what you have really helps you to sleep well. Yes, we have lots of questions there. Go ahead.
My question is that have there been any studies found that people that have stroke, are they more, or the percentage of either development Alzheimer's or dementia increase as the stroke survivors?
So strokes does cause what we call as vascular dementias, and these dementias don't occur as silos. A person can have more than one type of pathology for dementia. But depending on how severe the stroke is and where the stroke is, it does affect memory.
I think we have time for
one more question. Okay, we'll take your question then.
What are the minimal doctors patients have? My sister, I'm just getting her set up with a doctor. I've got her primary care, she's a radiologist, a specialist, she has no other health.
So there is no minimum, as it depends on the person, but having a good primary care. And initially when you're diagnosing dementia, having a neurologist is good, but then the neurologist and the primary care work together and decide, especially if the primary care is a geriatric primary care, they are trained to take care of persons with dementia. So not every person needs to have both, but then you just need a good primary care who's going to work with all the other doctors that your sister has, and then help to minimize the number of visits you go. Like you don't have to go to a cardiologist every 3 months. Maybe once a year based on what the cardiology issues, if they have a cardiologist, a nephrologist or a urologist. Every body part doesn't need one, you just need to look at the whole person. And if you do need, it's fine, but making sure that the primary care is the one who is in charge and communicating and keeping everybody on the same page. Well, I just want to acknowledge, I think Dr. Shishadri walked into, yeah, she's right here. She's a director of the Geriatrics. You'll be hearing her talk. Did you want to add to that any of the answers? Thank you all. And I'm around if anybody has any questions. Thank you so much.
I feel really badly about having to cut her off because that was amazing. Just very practical. So thank you very much, Dr. So I do want to take one quick second to thank our Alzheimer's staff. So they're running around in these purple shirts. I know Jenny is back here. Awesome others, but make sure that you thank them. There's a lot of person here today. They're wearing the purple shirts that say the walk.